Hello, City of Houston employees. It's time for our annual open enrollment for employee health benefits. We continue to improve upon our available health benefits while ensuring they remain affordable and competitive. Unfortunately, rates will be going up this year, and the increase will seem larger than last year. This is because we were able to minimize last year's rate changes through the federal government's Early Retiree Reinsurance Program, which was a temporary program authorized in the Affordable Care Act, but it's now over. While I regret the necessity of the rate increases, I'm excited to announce several new enhancements. For the first time, we'll offer a standalone vision plan for you and your dependents. This plan has a low monthly contribution and provides access to glasses, lenses, contact lenses, and other vision services at reasonable co-payments. The city's limited network plan will expand again to include a new IPA, the Mayor Group. Employee Assistance Program services will expand to include the addition of an outsourced group of EAP providers, which will result in wider access. There'll also be some additional preventive care benefits provided free of charge in accordance with the Affordable Care Act. Wellness continues to play a vital role in our medical plan. Each year, employees who elect the city's medical plan and participate in the annual health assessment and wellness engagement programs will pay $25 to $50 less a month in contributions than those who do not participate. Retirees and dependents, while not required, are encouraged to participate. The wellness efforts are yielding results. Employees report improved overall well-being, weight loss, better eating habits, increased physical activity, and more. Some have even halted the progression of life-threatening diseases. Discover Health with the Wellness Connection has some fresh and creative new programs planned that will include rewards for participation. More to come on that later. I encourage everyone to take advantage of the program being offered, not just to save money or to earn rewards, but to make your health a priority. You deserve it.
Here's a snapshot of what's new this year. Rates will increase across all tiers starting May 1st. The Cigna Limited Network now includes a $100 individual and a $300 family deductible. Some co-payments and co-insurance amounts are increasing. There are a few other plan design changes. Continue watching for more details on these changes. All of the plan changes were made in an effort to keep rate increases down. The good news is that the new plan enhancements give you more choices. The Cigna Limited Network plan continues to expand with an addition of another IPA, the Mayor Healthcare Group. For the first time, you will have the option of participating in a standalone vision plan. The Employee Assistance Program is being enhanced to offer you more choice of practitioners and locations. There are a few more preventative care services that will be provided at no charge due to the provisions in the Affordable Care Act. This is an active enrollment. This means that you must re-enroll in the medical plan of your choice or you will be defaulted in the Cigna Open Access Plan, which has the largest network but the highest contributions of the three plans. If you have previously waived medical coverage, you do not need to do anything to retain your waived status. You can enroll or make changes to your medical, dental, or supplemental plan. You can enroll in the new vision plan. You can add or drop dependents. And you can enroll in the HFSA. You will also be prompted to update your life insurance beneficiary. You must declare if you or a covered dependent use tobacco products. If you are satisfied with your current medical plan choices, you will need to re-enroll or you will be defaulted into the Open Access Plan. This is an active enrollment, so you must re-enroll to retain your choices. If you will be covering any dependents, you will need to gather the following for each: Social Security numbers, date of birth, birth certificates for newly added dependent children, marriage license or certificate of registration and declaration of an informal marriage for newly added legal spouse.
You have 3 medical plans to choose from: the Cigna Limited Network Plan, the Cigna Open Access Plan, and the Consumer-Driven Health Plan. The Cigna Limited Network Plan is similar to an HMO with co-payments. New this year is a $100 individual and $300 family deductible for medical services. The Cigna Limited Network Plan also includes pharmacy benefits with a separate deductible of $100 for an individual and $300 for a family. There are 4 tiers of prescriptions. All of your medical care comes from one of 3 IPAs: Kelsey Care, the newly added Mayor Health Group IPA, or Renaissance IPA. Although the IPAs include differing providers and referral processes, the benefits are exactly the same in each. If you choose the Cigna Limited Network plan, you will need to select one of these IPAs. If you are a current member of the Cigna Limited Network plan and intend to remain in that plan, you must re-enroll. For the Renaissance and Mayor Healthcare Group IPAs, you must select a PCP to coordinate your care. You may switch from one IPA to the other, effective the first day of the month following your change. Family members may be in different IPAs. In addition to the new medical service deductibles, there are changes to copayments, out-of-pocket maximums, and more. PCP visits increase from $30 to $35, and specialist visits increase from $60 to $100. The yearly maximum for inpatient hospital and facility services increases from $1,000 to $1,500. Prescription drug copayments for preferred brands increases from $45 to $60 and from $60 to $85 for non-preferred. The annual out-of-pocket maximum increases from $1,500 for an individual to $2,000 and from $3,000 to $4,000 for a family. The Cigna Open Access Plan is most like a PPO, but with in-network benefits only. Even so, you have access to more than 572,000 Cigna providers without the need for a referral. Emergency services are the only services available out of network. You pay copayments for routine visits and coinsurance for services such as inpatient and outpatient hospitalization. There are medical service deductibles in this plan. The Cigna Open Access Plan also includes a 4-tier prescription drug plan with no deductibles. The medical service deductibles for an individual increases from $400 to $500, and for a family from $800 to $1,000. PCP visits increase from $35 to $40, and specialist visits increase from $60 to $100. For doctors who are not Cigna Care Network specialists, you pay $115. Coinsurance increases from 20% to 30% for inpatient hospital, facility and professional services, outpatient surgery facility, and advanced radiology. The annual out-of-pocket maximum increases from $3,000 for an individual to $3,500 and from $6,000 to $7,000 for a family. There are no plan changes to the Cigna Consumer Driven Health Plan, or CDHP. The plan includes the same spacious network as the Open Access Plan, but also allows for you to go out of network at higher deductibles and coinsurance percentage. This plan has the lowest monthly contribution option, but the lower contribution can be offset by more money out of your pocket at the time of service. A health reimbursement account, or HRA, is also included with this plan. The city pays $500 for one person or $1,000 for a family into your HRA. That money will be used first to pay eligible health plan expenses. After you've used up your HRA, you'll be responsible for the remainder of your deductible. Once you've met your deductible, you'll pay 20% coinsurance in-network and 40% coinsurance out-of-network. The Cigna Open Access Plan also includes a 4-tier prescription drug plan. The coinsurance for all 4 tiers is 20% after the plan deductible.
For 2013, the Affordable Care Act expanded prevention coverage for women's health and well-being. Some of the services listed were already covered at no charge as part of the city's medical plans. The following is a complete list of services to be provided at no charge. Well woman visits, screening for gestational diabetes, human papillomavirus testing, counseling for sexually transmitted infections, counseling and screening for human immune deficiency virus. Contraceptive methods and counseling includes all FDA-approved contraceptive and sterilization methods. Breastfeeding support, supplies and counseling, which include comprehensive lactation support and rental costs for a breast pump. Screening and counseling for interpersonal and domestic violence.
Wellness is an integral part of the city's health plans and include a variety of programs tailored to the employee population, all available at no cost to the employee. Employees who participate in the annual health assessment and wellness engagement requirements can save $25 to $50 each month on their medical contributions. Retirees are not eligible for the wellness discounts, but are encouraged to take advantage of these free health tools. And, as in years past, if you and your covered family member do not use tobacco products, you can save another $25 per month in contributions. This year, we will be adding new incentive programs with additional rewards for employees who are committed to wellness. Look for the rollout for these programs in May. We've also extended a grace period for employees who did not participate in the health assessment. You will have 2 months to take the health assessment, and then you can take advantage of the wellness discounts. The following list are the current medical plan contributions. For a Cigna Limited Network plan, an employee only pays $27.49. An employee plus children pays $82.49. An employee plus spouse pays $109.99. And an employee plus family pays $164.98. For a Cigna Open Access plan, an employee only pays $42.77. An employee plus children pays $128.32. An employee plus spouse pays $171.10. And an employee plus family pays $256.64. For a consumer-driven health plan, an employee only pays $15.87. An employee plus children pays $47.66. An employee plus spouse pays $63.55. And an employee plus family pays $95.32.
You have two choices for your dental plan: a dental health maintenance organization, DHMO, and a dental indemnity plan. The DHMO has a network of dentists and orthodontists like an HMO. Your dental services are provided with a fixed copayment. You must choose a primary care dentist and you must live in the service area. There is no maximum annual limit, no deductibles, no claim forms with the DHMO plan. The dental indemnity plan lets you receive dental services from the provider of your choice anywhere in the United States. You do not need to choose a primary care dentist. You must pay a percentage of the charges for the services at the time of service. Then you must file a claim form for reimbursement. Some services require a deductible. By using an in-network dentist, you can help reduce your out-of-pocket expenses. These are the dentists that the plan contracts with for lower service rates. This plan includes a $50 individual and a $150 family deductible. The maximum annual benefit is $1,500 per individual. Dental contributions remain the same for the third consecutive year. Bi-weekly rates for employees are as listed. For DHMO, employee only is $4.50. Employee plus spouse is $10.35. Employee plus family is $14.18. For dental indemnity, employee only is $15.79. Employee plus spouse is $36.34. And employee plus family is $49.75.
New to your benefit plan options this year is the standalone vision plan. Block Vision is the administrator of this plan, which includes a list of participating providers. This plan will replace the limited benefit vision in the Cigna medical plan. There are no deductibles and no claim forms unless you use a non-network provider. You will have to pay for those services upfront and be reimbursed if you do not choose a provider from the list. The plan has 4 tiers like the medical plans. You can get coverage for you and all of your eligible dependents. Also, retirees who have a City Cigna plan have the option of participating in this plan. The plan includes a yearly eye exam, yearly eyewear coverage, free lenses, a $150 retail spending allowance for frames, and a one-time LASIK benefit with a $300 allowance towards the cost. The Vision bi-weekly rates are as follows. An employee only pays $3.83. An employee plus children pays $6.52. An employee plus spouse pays $6.90. And an employee plus family pays $10.35. Also, new this year are enhancements to the current Employee Assistance Program. Now you will have access to more than 2,000 mental health providers across the city. Access to this service is available 24 hours a day, 7 days a week, and 365 days a year. Phones are answered by licensed counselors. These services are available at no cost to you, and you can have up to 6 visits per issue.
Supplemental insurance is a benefit provided to active employees only. This insurance gives you the protection against the unexpected. This benefit is provided by Aflac. There are 3 plans available. Hospital-indemnity pays you a daily cash benefit while you or a covered dependent are hospitalized. This money can be used for expenses even if they are not medical expenses. This plan also offers an annual wellness benefit. The accident or disability plan provides a benefit if you or a covered dependent are injured or become disabled due to an accident covered by the plan. This payment is in addition to your city medical benefits and can be used for events such as emergency room use, initial hospitalization, hospital confinement, follow-up visits to the doctor, or other expenses unrelated to medical care, like your mortgage or groceries. This plan also offers an annual wellness benefit. The Personal Cancer Protection Plan provides supplemental insurance for you or a covered dependent diagnosed with cancer. A benefit is paid for most cancer treatments and inpatient care. Benefits are paid directly to you. You may use it to pay for medical, travel, or other expenses. This plan also offers an annual wellness benefit.
The Healthcare Flexible Spending Account, or HFSA, is a voluntary benefit that can help reduce your taxable income, saving you money. The maximum contribution is $2,500 a year. Reimbursable medical, dental, and vision expenses include copayments, coinsurance, and deductibles. With your Aflac Now card, it's easy to use your HFSA. Simply estimate how much you and your family spend on medical services, prescriptions, and other eligible expenses to determine how much you want to contribute. This amount will be deducted before taxes in 24 equal amounts. Use your Aflac Now card to pay for these expenses for instant reimbursement. You must incur expenses up to the total amount of your contribution by April 30th and file a claim for reimbursement by July 29th, or you will forfeit the remainder. If for some reason you cannot use your Aflac Now card, then you will need to file a claim form for reimbursement. The good news, the total amount of your election is available on May 1st. Your contributions will be deducted bi-weekly for the remainder of the plan year. Qualifying expenses include everything that you can deduct from your income tax according to the Internal Revenue Code 213. But remember, over-the-counter medications without a prescription are not eligible for reimbursement without a prescription. Some examples of eligible expenses include chiropractic care, contact lenses and solutions, diabetic supplies, eyeglasses and exams, hearing aids, physical therapy, smoking cessation programs, and speech therapy. Eligible dependents include your legal spouse from a formal or informal marriage. Common law marriages require legal documentation. Your children to age 26. Stepchildren or grandchildren to age 26 who live with you. Children with a pending adoption to age 26. Your disabled dependents over age 26 who were covered under the plan before they turned 26. And any children for whom you have a legal parent-child relationship. In all situations, the plan's eligibility rules and necessary documentation apply.
Now that you've seen this year's highlights, here's how to enroll. You must enroll online. Visit houstontx.gov/OE. Click on Enroll Now. ChoiceLinks is an online enrollment and benefit update tool that walks you step by step through the enrollment process. You can enroll in benefits now during this open enrollment period or make changes later on due to life events like marriage, divorce, birth, and more. If you add new dependents, you will have 30 days following open enrollment to provide the necessary documentation, or those dependents will not have coverage. Documents include marriage license and birth certificates. As a benefit, you'll receive basic life insurance of 1 times your salary with no cost to you, and you may elect to increase your life insurance up to 4 times your salary. You will be required to add beneficiaries on ChoiceLinks. Money will not be paid out to a minor. If you choose a minor, they will not receive any benefit until they reach the age of 18. If your life situation changes at any time, marriage, divorce, or death, you should update your beneficiary as soon as possible. You can get fact sheets, comparison charts, plan summaries, provider directories, and other tools at www.houstontx.gov/OE. If you need assistance, contact the Benefits Division of Human Resources at benefits@houstontx.gov or call 713-837-9400 or the toll-free number 888-205-9266 or contact Cigna Customer Service at 800-997-1406. The enrollment period begins Sunday, March 17th and ends Monday, April 15th. Remember, this is an active enrollment and you must select a plan, or you will be automatically enrolled in the Open Access Plan.